with more Loriisms for the South Coast Midwifery people and families. So today we're going to be talking about what you need to do to get your home ready for the home birth and the things to gather up, because this does require more responsibility on your part than, say, just going to a hospital, or actually even more so than coming to the birth center. But and rest assured, of course, the midwives will be bringing all of the medical equipment, the midwifery equipment, the IVs, emergency equipment, all of that with us. But this part's about what you need to get together. So the first thing I want to talk about is, and in the previous little clip, you probably saw us talking about your birth kit. This is something that you're going to get from us around 35-36 weeks of gestation, and that will be the first thing on your list to get together. Okay, then I'm going to show you what we got here. So we're also going to ask that you please have a pediatrician's phone number, the one that you've chosen and you feel comfortable with and you believe that agrees with your philosophy. Have that phone number available for us at the house should there become a reason that we need to consult with them about your baby's care. All right, so over here I'm going to show you some things that we ask you to gather up. One of the things is having a thermometer. Of course, you don't have to have this kind of thermometer. You can have one of the regular digital thermometers, and but just have that available. Then we would like for you, now this is going to sound funny, but we need for you to have a roll of toilet paper available or a box of Kleenex. And that's just for, it's nothing unusual, but when we listen to your baby and we're going to wipe off the lubricant from mommy's tummy, or during pushing, sometimes there's various body fluids that come out and we just wipe it away. That's what it's for. And then we ask that you have a couple of large paper bags. This happens to be Trader Joe's. But we ask that you have a few of those available, along with some plastic trash bags. The kitchen ones are fine too, the tall kitchen ones. These are the big dark ones, which are bigger, which are great. And what we do is we line these paper bags with the liners, and we use them, and we have various places that whenever we're done after having the baby, we'll just be able to scoop all this trash up and throw it away really easily. So then oh yes, very important. We'd like for you to have a flashlight with batteries that work. Oftentimes people forget to check the batteries, so we want to make sure you have a good flashlight. And that's sometimes we're just seeing when we're excited and we're seeing the baby's head coming, because we usually give birth in dim lighting, so it's nice to be able to see that. We also would like for you to have a bottle of hydrogen peroxide. That is used for a little blood spills, if that gets on your carpet or your any of your furniture, that kind of thing. You just pour this on, it bubbles up, we scrub it out, and your house is going to look awesome. It's amazing. Also, we want you to have some witch hazel. We will be instructing you in your handbook about how to prepare your peri pads that we talked about in the last episode with witch hazel, and freeze those to make mama feel really comfortable afterwards. A hand mirror is really good because sometimes mamas want to see the baby coming out, and it's really cool. So have that available just in case she wants to. Also having some extra sanitary pads. We give you about a dozen, but we encourage you to have a lot more. And you may even want to have some, it sounds funny, but some of those the underpads, you know, the Depends are really great. I know it sounds funny, but we put one of these in there and the underpad, and then you won't be afraid of like spilling over if you have a little bit of blood when you're sleeping and that kind of thing. So it's really nice to have. We encourage you to have about 4 to 10 washcloths. As you can see, they don't have to be pretty. They can be any color. They can be anything. We use these for when the babies come. We make nice warm water, and we use them as compresses against the mama's perineum and everywhere where the baby's coming through, to help those muscles really relax and open up as much as they can so that you don't tear. We also encourage you to have a bunch of towels. Now, we don't say how many. It could be 4, it could be 10, but we love for you to have a bunch of towels so that when we like to treat you like a queen. After you've had the baby, we're going to help you shower, bathe, get out. We're going to all be drying you, brushing your hair. So we want you to have a whole bunch and feel something that you're not worried about getting dirty, or you wouldn't mind throwing away. we're going to ask that you have a bunch of receiving blankets. Again, they don't have to be the pretty ones that you're saving from your grandma, that kind of thing. You could even recycle. You could even go to like a thrift store and get a whole bunch of these and have them. So we just use them in case, right after the baby's born, we wipe, when it is needed, we will wipe the baby off, the vernix, if there's any meconium or blood or amniotic fluid. So we just want you to have a bunch of these. We also want you to have a heating pad. One of the kind that does not have an automatic shutoff. Because what we use this for is that we warm the blankets while you're laboring, and then the blankets are nice and warm and right at the bedside after you have the baby. And also if we had to help the baby in any way afterwards, those are going to be all warm and there'll be a nice warm spot for the baby to be at. Let's see. Oh yeah, and I'd like for you to have, please, a couple of pots. And that is for, we keep talking about those warm compresses. So it is like you might have heard in the old days, they'd say, boil the water, get the midwife, boil the water. Well, we want to use that boiled water for warm compresses to help you not tear. Let's see. We also ask that you have a few large bowls, like something like this, preferably plastic, but just not heavy metal bowls, because we fill them with our equipment and the midwife kind of moves around her equipment wherever the mama goes. Because unlike in the hospital where the mama stays in one place and the staff comes, we follow mama around. So if you're laboring in the tub, we follow you. If you go to the bed, we follow you, and we bring that equipment with us. Let's see. Then we're also going to have you get together juices, and for the mama you want to make sure that it's not acidic, not orange juice, but something like, it could be apple juice or something, but she should be drinking every hour at least 4 ounces and something with calories, not just water. So you want to have that available. Also, let's see, you might want to just get some extra Chucks pads from these are, I call them Chucks, but they're actually absorbent underpads. And they're in the incontinence department, but buy a bunch, because then you can sit on them on your couch and you're not going to worry about bleeding over, that kind of thing. So again, this is just some stuff. I want to encourage you to just set it all out, or you could actually put it in a laundry basket, just so that when we come to your house, it'll be all there. Oops, I forgot to mention one last thing. Either a cookie sheet or a large cutting board. We use this should the baby have problems with breathing, and we have the warm towels on it. We have a space. If you were in the tub, we can put this right next to the tub without cutting the cord. The baby can be kept right next to you in case there was any issues that we needed to help the baby with. We can sit them on this. So we want you to have an extension cord, because what we do is we plug in the heating pads, and the resuscitation or the little hard surface that we would work on a baby if there was any kind of problems or help the baby, we'll need to get it close to you. So make sure you have an extension cord. It doesn't need to be a 30-footer. We've had people with the really super long ones, but this is just a normal one. Also, okay, a fish net. This is a little fishing net, and a lot of people like to labor in the water, of course, and sometimes things float in the water. Sometimes it's little blood clots or mucus or something that mom doesn't want to see, and we'll just scoop it out. So it's really convenient. The other thing I'd like for you guys to have is a couple of Ziplocs. One is, let's put all the babies, like a little diaper and little clothes, whatever you want, whatever special items you want the baby to wear right after the birth. And then make another one that's for mama. Put maybe some special nightie that she wants to wear in there. But if you don't do this ahead of time, you know what, dads, you don't usually know where this stuff is. And the mama's, she's like tired. She's saying it's in the left drawer and the bottom right, and it's kind of challenging. So having it all together is really good. Another thing that is really trendy now is drinking coconut water, when it's great because it has electrolytes and all kinds of things. And we definitely want you hydrated during your labor. So maybe having some coconut water. You can have it flavored, unflavored, whatever your preference is. But that's it for today, okay? Have a good time putting it all together.